couple of hours from now, the president holds a meeting in the White House, and it's to discuss vaping. Looks like he's not going to go through with what some were saying would be a vaping ban. Let's bring in Greg Conley, Vaping Association president, who will be at the meeting. First of all, Greg, what are you going to tell the president?
First off, thanks for having us. Our message to the president is going to be simple. You have Michael Bloomberg out there funding a $160 million campaign to try to ban the sale of virtually every single vaping product on the market. If Michael Bloomberg and various health activists that he's funding are supporting a ban that's going to shut down over 10,000 small businesses, maybe it's something that needs to be rethought. We need sensible regulation, not just prohibition.
Now, there has been a suggestion from the American Medical Association that is, you can only get a vaping device on prescription. That, they say, would keep them out of the hands of kids and would stop anybody getting addicted to nicotine simply because they're getting off smoking. What do you say to the prescription idea?
Well, the American Medical Association's presentation of that idea, that policy idea, was incredibly dishonest. Their sole reason, seemingly, for proposing this were the illnesses and deaths that the CDC, lung illnesses and deaths that the CDC is now saying are linked not to store-bought nicotine vaping products, but to illicit contaminated THC cartridges, marijuana oils. So what you have the AMA doing, they're not talking about the fact that in order to go through a new drug process, it's about 3 years before you hit the first human clinical trial. So what are the 4 to 5 million adult ex-smokers who vape and rely on these products supposed to do for 5+ years? The answer? They're going to turn to black market Chinese products, or they are going to return to smoking combustible cigarettes, which even the FDA says would be a terrible result of regulation.
I got to say, I'm a little surprised at the reaction in America, because there is not exactly a war on vaping, but it's very much in the news, and heavy-duty restrictions are being proposed. It's in such stark contrast to Britain, where everybody vapes and the government encourages vaping as the best way of getting off smoking tobacco. How do you explain this complete difference?
It's truly amazing. I was just in Liverpool and Manchester this weekend, and to see people vaping and proud of the fact that they have quit smoking, in contrast to the U.S., where you have people who have quit smoking who are now being scared into returning to cigarettes. Unfortunately, it's about money and ideology. When you have American public health groups, some of the ones represented today at today's meeting, receiving $160 million from Michael Bloomberg, not to study e-cigarettes, not to take this money, and you as public health activists or advocates, you do what you feel is right. Bloomberg gave the money specifically to ban vaping products. And so when you have $160 million and you have people that are just ideologically opposed to anything that looks like smoking, you get proposals like this.
Fascinating. Greg, we wish you well in your meeting today. Come back soon and report for us. We'd like to hear that. Thank you. Greg Conley. Thank you, sir. Appreciate it. Thank you.
Thank you.